Hey, Roberto Monaco here with the Chiro Speaking Company. And in this video, you're going to discover why the saying there is riches in the niches with my friend, Dr. Rob Scranton. Let's do this. All right, welcome, my friend, Dr. Robert Scranton. What's up, buddy? How are you doing?
Doing great, Roberto. Nice to see you as always.
Good to see you. Great to have you here. Now, Dr. Rob and I go back. We are just right before the interview here. We're trying to figure out the year. I'm assuming was probably around maybe 8-9 years ago. We met. Dr. Rob came to our class in First to the Front. And he had, we always were connected through Gary Gunderson. And now Dr. Rob has a really successful company that does help chiropractors grow their practices with niches. Specifically, we're talking about knee. Today is going to be awesome. The question I have for you, because I'm very curious, Dr. Rob, why have you decided to do your practice with niches? Why is that?
Well, that's a really good question, Roberto. I think I was in a situation like a lot of chiropractors where, I'd been growing my practice when I started, one patient at a time, and you're not very busy sometimes in the beginning. But as I got busier and I started to realize that I was getting sore and tired and worn out, and ultimately feeling like, man, I just feel like there's some real limits and caps on my income because there's only so many hours in the day and there's only so many days in the week and I can't work them all. And in fact, my wife wasn't going to let me work them all. And once we started having kids, she absolutely wasn't going to let me work them all. And it's just very frustrating to feel like I was an entrepreneur, but it felt like there was a real ceiling or cap on my income. And so it actually got so frustrating because with little kids, it was tough for my wife to step in and help out at that office. And so one of the options is just to stop. But I had a lot of opportunities before me because I had an accounting and finance degree before that. And as you mentioned, I got connected with a guy named Garrett Gunderson. And he's like, man, you know so much about, the program and what we do, and you implemented things so fast, obviously because of your experience and background and degrees. I was a financial analyst for the Florsheim Shoe Company before I became a chiropractor. And he's like, the chiropractic industry so well, what about would you ever consider coming to work for us? And I was like, wow, that'd be kind of cool. I'm kind of burnt out on this chiropractic stuff and, slam and ham, as we say. My elbows getting sore, my shoulders getting sore, my back getting worn out. And but he said the one caveat is like, you'd have to move out here to Utah. And so we had to look at a map because we didn't know where Utah was. I think we were pretty sure it was one of the four corners that connected, but I don't think we could have pointed to it on a blank map and told you which one it was for sure. And we sold that practice. We found somebody that was interested in buying that it had went to Palmer and married somebody locally, and she had kids and wanted to come back. And so we sold it and moved out here to Utah. Had a great 2 years meeting people like yourself and so many people in the chiropractic profession, getting connected, throughout the profession, traveling around with Garrett, going and speaking for his company, for various companies and different venues through your training. Thank you for that. So I always tell people, whether they think I'm a good presenter or teacher, they can thank Roberto. And if they think I'm terrible, they can blame him.
I appreciate that.
But after doing that for a couple of years and going around the profession, I started getting a whole different vision, 2 ways to step away and really pull way back with a wide lens at what I had been doing, the model that I'd been taught and I had learned, kind of that legacy chiropractic adjusting only model. Yeah. I realized it just really wasn't working for me and wasn't going to work, and all the frustrations I had. But I started seeing, this concept of being more like a medical doctor, where we charge for what we do and the results that we get for people, rather than charging for our time or per visit basis. And so I left Garrett's company and decided to start a new practice here in Utah, a state I'd never been, practiced in before, lived in before, didn't know anybody, didn't have any friends or family. And we started an all cash practice, and we did 55,000 in collections the very first month that we were in practice, which is kind of unprecedented. A
Wow, that's
management
awesome.
company that I'd been with in the past, I said, well, what's your record for, opening a new practice? And I think they said like 25,000 was the biggest first month anybody in their company had ever had. I said, well, at least that gives me a target. But obviously, we kind of obliterated that. And, word spread or got around about this guy that, opened up from scratch and had a bigger practice his first month than most chiropractors ever had their, in a month in their entire career in some cases. And so people started inquiring and asking me, and I think, boy, there's a lot of interest in this and what we're doing. And I had a lot more time freedom, a lot more income. I mean, I'd never collected 55,000 in a month in my entire 12-year career practicing in Illinois, just for instance. And in a couple of years, we had that practice from a scratch brand new practice to over $1 million a year practice. And so people started coming out to visit us and watch what we were doing. And then I had one doctor that wanted to move from Texas, where he'd practiced for about 10 years, and wanted to move to North Dakota. And he's like, can you show me? Can you tell me? I don't want to grow slow or open up slow or, that kind of thing. And he's like, can you show me exactly what you did and how you did it? And I think he'd never, collected more than 40 to 60,000, probably his highest month ever when he was in Texas. And so I coached him, this Dr. Matt that moved to, North Dakota, every single week for a year. And he was a very good implementer, just doing exactly what we told him to do. And it was easy because I didn't have to make anything up or, use theory or ideas that worked 20, 25 years ago. I just told him what I did, like, a year or two before. And so he just did exactly what I did. But of course, he didn't have to make all the mistakes that I made because I just told him the stuff that actually worked. And so you got to skip all those hard lessons
For sure.
and just do the things that actually did work. And he opened his very first month with 60,000 in collections.
Nice.
His very first month in North Dakota, as much as his highest month he'd ever had in 10 years in his previous practice. And I started thinking to myself, gosh, this is seems like this could be replicated, or people can, follow this model. And I started having other doctors, wanting to know how to do that as well.
So when you start doing niches, you start from day one doing niches already?
In this new practice, yes. So
Wow.
I had this vision of $1 million practice. I think when I practiced in Rock Island, probably like a lot of chiropractors, when I'd hear about $1 million practices, I'm like, oh, they must have some huge PI practice and must be a brother-in-law of all the attorneys in town or something, or they must be doing something illegal or cheating or stealing or ripping people off. There's no way somebody could do, $1 million in a year. But I went to a mastermind in Switzerland. I met 20 other doctors that were all collecting over $1 million a year. And my paradigm and my concepts shifted immediately because I thought, well, 2 or 3 of these guys could be telling me a story or making that up, but not 20.
Not 20, yeah.
So I need to, think about this differently. And that's where I got this idea, like, oh, I could really leverage my time, because in a traditional chiropractic practice, every single dollar that clinic collects, goes through the hands, of the practitioner. But I was like, if I could, be the consultant and do the exams and then sell people on care and turn the treatment over to somebody else, that would free up a tremendous amount of time. So yeah, that practice here in Utah, instead of working 4.5 days a week, I cut my hours down to 3.5 days a week. So I worked less, and, made, 3 times the income, and almost right away, out of the gate.
That's amazing. So when you talk about I love the story. By the way, guys, Dr. Rob has an amazing event coming up, the greatest knee pain event ever, which yours truly will be speaking. And if you want to learn more about it, the event, there's a link below here. You can go to www.clinic -masters.
Very modest title. Very modest title, right?
No, I love it. I love it. And then we're going to talk more about the event. But before, a quick question here, Dr. Rob: why the knee? Why knee? Why this niche specifically?
Why the knee? Yeah, so I'll just kind of tell you a little bit of the genesis. Early on, I helped run a niche program called Fibromyalgia Centers of America. It still exists today, and that's where I first got the idea about niches, but it still revolved mainly around a niche within chiropractic and still required me a lot of work and every dollar going through my hands again. So it didn't really solve that problem. We could charge more, so it helped with the income side of things. But I had always been treating plantar fasciitis cases. And I usually would have people come in and do kind of a specialty treatment program, but we would usually have a trial treatment that was so phenomenal and changed things for people, almost instantly from pain and crippling pain to completely relief almost instantaneously. So it was very easy for them to say yes to our treatment recommendations. And so we kind of started applying that same concept to how we approach the knee, because I've been fixing, chronic knee problems for 20 years.
That's
but
awesome.
I'd never really charged appropriately for the results that we got and the change that we made for the patient. And so when I started thinking about that with applying this niche model to us, getting results for people that none of their medical doctors and very few chiropractors are getting for them, and put it into a package. And then when we applied this miracle quadrant of treatments in kind of this test treatment, and we're finding patients repeatedly getting up off the table, 15 minutes after they met the doctor, 20 minutes after they met the doctor, saying, oh my goodness, this is 75% better. This is 80% better. This is 65% better. It's not very hard, even for chiropractors that don't consider themselves salesmen, or that sounds dirty, or they're uncomfortable with the concept. They don't really have to be salesmen. They don't really have to be good at sales, because that experience sells itself. And then all of a sudden you have the patients reaching for you instead of you reaching for the patient. I know you know what I'm talking about, Roberto. But
how many in an average month, how many quote unquote people inquire about knee support, like in your practice, for example, one of your clients' practices?
Yeah,
how big is the problem? How big is the problem?
Over time, that's the other reason that we chose the knee niche, because the two we specialize in, I know there's companies out there that have a whole bunch of niches you can choose from. The problem was that we saw that a lot of them were a mile wide in what they offered, but an inch deep in their protocols and procedures and what the doctor was able to learn. So we'd instead decide to concentrate really narrowly. So maybe an inch wide, but go a mile deep in what we taught and provided the doctors. And I've probably done every niche that you could possibly name in chiropractic, including weight loss and other things. And we just found that the knee niche and the peripheral neuropathy niche, because literally, the medical profession is creating more and more of these cases for us every day. And there's almost an unlimited supply of new patients out there needing and wanting help desperately and not getting it. That it just made these two niches made the most sense, because they're the easiest to implement. They're the simplest for the doctors to implement. They're the most profitable. There's the biggest abundance of new patients out there that just never seem to run out. A lot of those other niches, we do really well at first, and then it just seemed to kind of die out overnight. And that just doesn't seem to be the case.
What is the average case? What is the average case for, and no, I'm sure that varies according to what the patient needs, but in average, what is the average case for a knee patient?
Typically, our doctors on the lowest side would be around $5,000 and upwards of $7,000 to $8,000 per knee case.
Okay, cool. And compared to a 3-month chiropractic care, where let's say the first 3 months people are seeing 3 times a week for 3 months, how much in this knee care? How many visits? Just for me to have an idea, I'm just curious. How many visits, or how does the treatment work?
Yeah, so usually around.
How you give your secrets away?
You're making me spill all the beans, Roberto. But
no, just an idea, like the frequency the patients go in and they see you guys.
It'd be less, because really the thing is about it is just so much easier on the doctor. Some cases may be less, some cases may be more, but we teach the doctors to make those care recommendations based on how the body heals, and especially the ligaments heal. So it's typically quite a few or less visits than what they're used to with chiropractic, because we're doing a lot of supportive and adjunctive, therapies, along with correction of the problem. And the other nice thing is, instead of having to assess all 24 joints in the spine, you're just working on one joint.
Yeah, that's awesome.
And it typically aligns in a very similar way, and it's fairly easy on the doctor's body. So
awesome.
You can fit a lot more knee adjustments in a given time frame than you can chiropractic patients.
Very interesting. So let's talk about the upcoming event that you have. What's going to go down?
Yeah, awesome. Well, obviously you're going to be speaking there. We have some exciting things. We've been really successful with in-person and lunch seminars, in-office seminars. We did those for niches for about 9 years, really successfully, consistently, and until we got too busy that we didn't have time to go out into the community to do those. But we found they were very successful until the pandemic hit, and then they just kind of shut down altogether, and we had to shift to other marketing things and ideas. But we feel like most areas of the country, that people are kind of okay again with being around strangers or sitting and eating next to somebody that they don't know and so forth. And so we feel like it's time to kind of open that back up again. So we're going to be teaching that, and you're going to be part of that, because as you taught me, the most important, you can almost have anything you want on the slides of the presentation of the PowerPoint, but it's creating that really attractive, interesting story to connect the audience to you and give them a reason of like, why should I listen to this guy, and make yourself an authority without telling people that you're an authority, and position yourself at the beginning of your talk, and then obviously closing it so you get people to take action or do something that's going to change and impact your life. I think you had a specific word you used to use around that, and I was trying to remember what that was.
We talk about the pre-frame. We're going to tell the personal story, which
we're
going to be sharing with the attendees. By the way, guys, if you want to learn more about the event, go to the website below, and there's information. There's a link for you to sign up. And then, so I'll be talking about, Dr. Rob already has the presentation, but I'm going to talk about how do you frame the whole talk with your personal story, and some strategies for you to close the talk effectively during the pre-close and close. It's going to be amazing.
So we're going to have that. And then obviously, our purpose of that boot camp is, there's people that teach niches out there, but really there's just a bunch of videos on a website, and you're kind of left to yourself to go figure it out and connect all the dots. And unfortunately, oftentimes there's not a whole lot more than like, here's a marketing company and here's some equipment to buy. And we wanted to come into the marketplace and solve that problem by really giving the doctors all the protocols and procedures. Again, basically, not theory or ideas or stuff that used to work 20 years ago. It's really easy to teach people stuff that works really well when you're just telling them what you've already done, in explaining that to them. And we try to do that to give the doctors everything that they would need to go back the next week and implement this knee niche, in those 2 days. So it's really hard hitting. It's not going to be a boot camp where they're going to come and listen to endless parade of people walk across stage and try to sell them stuff. I mean, it's going to be, content heavy, and we are going to train and try to dump everything in our brain into their brain in those 2 days.
I love it. So again, guys, join us at our upcoming event, the greatest knee event on the planet. By the way, I love the name.
Change the name. All right. We might
the planet. That's ever the planet. You gotta be the planet. I changed the name.
There you go.
No, but I love it because when I saw it, I'm like, man, that's such a good name, because you hear about the niche, but that's specifically if you're a chiropractor and you want to incorporate the niche of helping people with the knee and learn more about it, then join us. It's going to be an amazing event. I can't wait to see you there. Dr. Rob, do you have any special final words for us here to finish up the video?
No, just love to see you there. I really truly believe in my heart that these two niches, there is such a need and demand out there, and our protocols and procedures, work so well. I mean, it's, I talked about the $1 million mark seems so obscene to me at one time, but that's kind of the norm within Clinic Masters. Most of our doctors, if they really implement and do what we tell them to and what we're teaching, they'll reach that 100,000 a month within 6 to 12 months, pretty consistently. So we'd love to meet any of you there, but we really feel like every office in the country, every market should be doing 50,000 a month in knee treatment and 50,000 a month in neuropathy treatment, just by implementing these protocols and procedures. They work so well, and they've been tested in the heat of battle, and they just flat out work. And this knee treatment protocol is violently effective.
That's amazing. That's amazing. Dr. Rob, thanks so much. Thanks so much for watching us, and I see you at the event. God bless. Bye-bye.
Look forward to it. See you.